Okay, we're live. Okay, we're live.
Good afternoon, everybody, and welcome to SACU's Town Hall session. Today, we're going to be talking about food insecurity being on the rise and how to access food resources during the COVID-19 pandemic. This event is organized by SACU, the Southern African Community Organization, and one of its members, Cassandra, is going to take us off and talk a little bit about SACU and who we have here today.
Thank you, Toko. Welcome, welcome, everybody. We are glad you could take the time to join us on our first town hall, Food Insecurity on the Rise. So we appreciate you spending the time to join us. And I am going to introduce you to the SACU co-founders, the executive team. I will start with myself. I am Cassandra Sibandaguni from Zimbabwe. I am in the marketing team. And in the marketing team, I work along with Dr. Stinga Kachipande. She is originally from Malawi, so she's also on the call. In the event planning team, our mighty warrior, Lisa Netas-Yavong, she is the one who makes sure that these events happen and we stay on track, and we appreciate her. She's originally from Namibia. So thank you, Lisa. In the finance team, we have Rachel Niwete Ledesma. She is from originally from Angola. And along in that finance team, she works with Edie Sandele, who is originally from Tanzania. And we also have our admin team. The admin team, these are the people who make sure that the contracts, all the T's are dotted, the I's are dotted, T's crossed. And we have Nadine Galdino, originally from Angola. She works along with Omega Tawaneji, originally from Zimbabwe. And we also have Mike Hove. Mike Hove is originally from Zimbabwe, and Mike is in our tech team. So Mike is our floater in the executive team. Thank you. Back to you, Toko.
Thank you, Cassandra. And what a great team that you guys have. Well, I'm Toko Kachipande, and I'm a SACU volunteer, and I'm going to be your moderator for today's session. We're going to go through a couple of sessions, discuss the topic of food insecurity, and then at the end, we're going to have a Q&A session where people who are viewing are able to ask questions and get members of our community leaders, as well as those on the panel, to answer those. Now, this year, SACU partnered with Mana Food Center in an effort to help make sure that all community members, including those from African immigrant communities, have access to good, nutritious, quality food. Mana Food Center, also known as Mana, is a local nonprofit that strives to end hunger and offers free food distribution to those in Montgomery County, Maryland. Our joint goal is to encourage outreach and be culturally sensitive as we inform about the available services and current eligibility. Now, food insecurity and hunger can often go unnoticed, especially in more affluent areas. It is a complex issue that impacts racial and ethnic minority households at higher rates, and of course impacts our overall health and well-being. Food insecurity is the lack of having enough food to live a healthy and active life. Due to COVID and its impact on the economy, it's hit a lot of people really hard and has exacerbated the issue of food insecurity, the issue of hunger. According to Feed America and the Pew Research, approximately 17 million more people are at risk of food insecurity this year, We've all seen the long lines on the news of people in their cars waiting to get access to food assistance, or people standing outside in the cold, more so this year than we've seen during other years due to the economic impact and the need for food. So with all those numbers, approximately 54 million people in this country are likely to be in need of food assistance this year. It's a serious issue and it's a serious topic that we're happy to have the opportunity to discuss today. Let's start off by meeting SACU's outreach workers. Now, the outreach workers are working with SACU to reach out to members of their community to help them access food resources and answer questions that they may have about how to access food through MANA and any other questions that we can help them with. With us today, we have two of the outreach workers, Bernadette Mpaluko, as well as Kenga Chaplin. Kenga, let's start with you. What has it been like working with Africans who are or may be at risk of hunger and food insecurity? What has your experience so far been like? Kenga, we have you on mute.
There we go. Hello, everyone. Hello.
Hello.
Is that okay?
Yes, we can hear you now.
Okay, thank you. My name is Kenga and have been working for over a month as an outreach for SACU. And as an outreach worker, I have communicated and exchanged with different groups and people. My experience at the importance of having a referral to approach certain people, the benefit of working with spiritual leaders and schools on the issue of food insecurity, and that many members of the community migrated to be closer to their families. I realized the importance of being linked to someone close to the target after the experience I had with a young man who was in distress but could not verbalize it to me. I followed up with his aunt, who explained that it is for him very difficult to accept aid. Through her, I was able to build up trust with him, and in the end, he did agree to be helped. I was lucky enough to be able to speak with someone he trusted, and therefore he felt safe talking to me. And also, I've been encouraged by a friend who also worked for a charity group to make a lot of contacts with religious leaders, because they often visit or have deep conversations with parishioners and visit them for mental support. But we have to know that religious groups, institutions already have their charity program. So I had to explain that SACU's program with MANA Food Service doesn't cancel their own program, and on the contrary, will give additional help during the pandemic. Another suggestion has been made to me by the Islamic Center, who asked if it was possible for MANA Food Service with SACU to accept to have the food delivered for each person, of course, or family at the mosque. Like churches, schools also have food programs. But again, I had to explain that this doesn't cancel, our program doesn't cancel their own program. So my flyer and SACU's information and website have been shared to the parents-teacher distribution list. And I was also asked if SACU will check on the families from time to time to build a proximity with them for future problems they may have. I also discovered that many people living in Montgomery County before the pandemic already migrated to other cities or states to be closer to families and close friends, to have help from people they know. A lot of them ask if MANA Food Service operates in other counties of Maryland or other states, such as Massachusetts or Georgia. And in the end, I realized that they just made a move, but they still need help. Well, finally, I believe that speaking with family members, having conversations with spiritual leaders, and doing individual calls has helped a lot my outreach work. So far, the demographic I was able to touch more easily was women with children who are trying to make ends meet during the pandemic. They are willing to openly discuss their difficulties with another person. And probably it's because I'm a woman, it was easier, I don't know. That's the reason why for the future, I have the intention to be in contact with a group in Montgomery County. It's a group named Mother of Tacoma Park, to have a conversation with them about how program can aid the community. And I hope to continue reaching out to groups like that so they can open the distribution list once they trust me with these phone calls, and to see if they can put me in touch with anyone who may need help and who I can offer our services and our program. Mm-hmm. So that's what's so far.
Sorry, go on.
That was my experience so far.
Okay, so it sounds like you're reaching people who are expressing a need, not just in Montgomery County, but also areas where they might have moved to be family support, like you had said. Are you able to sort of direct them to other resources that are available out there outside of the county?
Yes, because I called MANA and asked them, and yes, they gave me some phone numbers I can give to these people so they can reach to other sources. And
that's great.
Yes.
That's great. And for those of you watching who are interested in reading more about the partnership or trying to figure out how to reach MANA, their web link is in chat, so you'll be able to connect with them from there. You mentioned that you're seeing a lot of women with children that you feel are easier for you to help. Are you seeing any other populations? I wonder if college students who might not have an immediate family member here, who might be international students, have you interacted with them?
So far, only one student, the one that I mentioned at the beginning, who was not really willing to tell me anything. And he's the only student for the moment. And I asked him if he knows other students by the conversation we have, because he called me sometimes, just ask him to call me to check if he's okay, because he was really in a mental state that needed someone to talk to sometimes. Yeah. So ask him if he know anybody, he can just contact me and we'll see what we can do for that person. But so far, he's the only one, to tell the truth.
Okay, and I think that's something important to keep in mind, in that there may be a lot of young people out there, and maybe in particular young men, who may not be willing to be straightforward or to come forward with their needs, and might, have other considerations and issues. So I think for everybody on here, it's important to try and find a way to reach out to them, like you mentioned, that you were able to reach out to the aunt and get that support.
Yes, because as one spiritual leader told me at the church, he told me that I have to consider not so pride, but shame of not making it in America, And so people can see that. That is something that I have to work on. I don't know how to approach that yet, but he told me that this is very important. They feel like they are not up to the expectations that the family, because we all have families back home, and we're up to the expectations that they can have once we come to America. That's what he told me also.
Oh, that's great. It sounds like religious leaders, or the ones that you're in touch with, have been a great support as well, and that's something to keep in mind. Bernadette, have you had similar experiences? What have you seen?
So just to add on what Kenga said, so my experience has been about following up. I've noticed that a lot of people, when they reach out to you, or rather they reach out to me, but then when I give them the information, they don't reach out back. So I have to follow with them. So for instance, there are two or three people that I had to email at least 3 times for them to reach out back. So what I did was, instead of telling them to email me back, I asked them to call me instead. And I had to make sure also for most of the people that are enrolled to tell them that it's confidential, because most of them, they think that since it's it's a food assistant, people might know that they need help. But I had to tell them that it's confidential. It's just between you and me and Mana Food Center. So nobody's going to know about this. It's just you and I. And they really opened up. And also some people, you actually have to go through friends or family, like Kenga said, to just tell them that this program is there for them to use. And I've talked to community leaders, and I've talked to pastors or priests about it, and I've announced it to the community that this program is there for them. And also, we need to take note that some people who will be reaching out are not only going to be from Southern Africa, they're going to be from other countries or continents. I've had 2 people from Pakistan reaching out and asking if it is okay for them to be enrolled. Since they're not from Africa, I had to tell them that this program is for everybody. Our goal was to reach to Southern Africa, but it's for everybody. So I had to enroll them as well. Mm-hmm. So far, that's my experience.
And that's an important thing to note, is that even though our focus is on reaching Southern Africans, we're really just trying to reach and encourage everybody who needs help to get that help.
Yes.
So pointing that out. Are there any other challenges that you have seen, Bernadette and Kenga, and how have you overcome it? What other ways or tips would you suggest for people who are a little bit hesitant to go ahead and take the next steps when they're in need?
For me, it was for them to tell me that, hey, I'm not actually in need of assistance, but I need something. Right now, I can't feed my whole family, but I have a job. Or some of them, they said their hours are being cut, but they're still making money. And what was important was to explain to them that this is just a supplement assistance program. It's not to feed them for the whole month or for 2 months. It's just for them, for supplementing what they have or what they're getting from another place. So I think explaining to them what the program is about, I think really helped.
Great. Kenga, do you have any other tips?
Just one phone call I had with a woman who is not living in Montgomery County, but she wanted to call another friend who was living in Montgomery County. But she said, wait, if I call her, she will know that I need help. So I had to really make a lot of talk and explain to her that this will help your friend, and you have to think about the support that you're giving to her rather than, what she will think about you. She will probably thank you for that service and for that help you gave her, but at the end she did not. But I intend to follow up again and again to see if she can just give me the phone number, because even that she didn't want it to give to me. So that's the kind of the communication between people. It's sometimes very difficult.
Yeah, and I'm glad you're doing all that follow-up work. Another thing, just moving on to our next segment, another thing that Bernadette and Kenga seem to have emphasized is that reaching out to religious or community leaders is key in making sure that people understand that they don't have that shame in getting assistance. And this is especially so in minority and immigrant populations like ours, because that's the extended family that we have when family's not always as close as we wish they were. And lately we've been hearing a lot more about the role of religious leaders and community organizers in making sure that people are getting access to the vaccine once it's available. So it really just highlights their key role in issues like this. So with us today, we have a couple of Southern African leaders from the DC area with home country-based associations and organizations. So let's welcome them. Our first is Clement Mutambo. He's president of the Association of Zambians in DC, Maryland, and Virginia. And we also have Tony Munongo, who's the founder of Tuduri, sorry, I'm butchering your association's name, but Tuduturi, a Congolese association in the DC area. So Tony and Clement, how does each of your organizations support community members in general in accessing social safety nets, like the resources that one might need to fight hunger and food insecurity? Tony, let's start with you.
Sure. So I would like to thank you for the opportunity to speak to this important topic, food insecurity. The Congolese community is not immune to that. Tuduturi itself is an organization that is trying to seek for solidarity among professionals and entrepreneurs in the Congolese community. So we don't directly reach out to people as for say, but what we did was to actually reach out to leaders very early on in the process. We were involved with reaching out to the Congolese community of the Washington metropolitan area, which basically has close to 1,000 members from Congolese that live in the area, and had them advertise and participate into promoting, if you want, the program, so that members of the community would know that this assistance is available to them. Now, maybe if I have a few more minutes later, I will talk about a few things that were shared by Kenga and Bernadette, because they also apply very well to our community.
Great. And Clement, what about your community?
Oh, yeah, thank you so much for the opportunity to speak as well. Yeah, and like
I think we're having trouble hearing you.
Oh, sorry, sorry, I think I was on mute. My apologies for that. Yeah, thank you so much for the opportunity to speak. Like Toko mentioned, I'm the new president of the Zambian Association in the DC, in the DMV area. So yeah, going back to our association, one thing that in this particular time that I've been serving, what I've noticed that they're very much proactive and engaging. Where needs and support is concerned. Yeah. So what we usually do is if there's a need, we kind of just put it out on our platform, and our communication. Our members of are so much proactive, like giving an individual feedback. Sometimes I get messages direct to me to say, "Oh, this person needs some support." So through them, it's been going quite well, despite the fact that there's been some few challenges. Not so many people still do come forth direct to us, especially if somebody referred them to, if there's a personal referral from one of my members. But going back to what Kenga and Bernadette mentioned as well, what we're also seeing is that churches and all these kind of groups, they play a very big role in how our members kind of have that confidence or that sense of how can I say it? Like the confidence to reach out in person. So we tend to use that as well. So right now I have one of the pastors that I'll be talking to about somebody's needs. So it's been quite good, though with a few challenges.
That's great. Why do you think it's so important for organizations like yours to get involved in this issue?
One of it is that I mean we're in a one particular platform, so it's easy to kind of spread out one single message to more than 100 people, So as a result, if that's exponential, it becomes much easier for people to kind of bring about ideas, and the feedback is always more like it's more precise and and faster, and then and my understanding is that all our community members have got friends and family and extended friends that they kind of talk to or they serve, so it's very much easier and important that we utilize our organizations and also make use of their connections like for instance, myself, I'm in like 9 WhatsApp groups, different, southern like soccer and stuff like that. So if there's a need like the food bank program, I not only share in the in our main platform, but I do share with other groups. So that's actually captures a very wider pool of audience.
And it definitely sounds like, somebody like you, and Tony as well, would be the people that would know your community members the most. And I think just having that trust from people who you probably interact with on a regular basis, allows people to confide in you a little more, especially with the concerns about privacy, because I think somebody can look at leaders like you and just have a little more confidence in that, you're somebody who's out there trying to help and wouldn't betray their privacy.
Yeah, that's a very big key. Privacy is, my view, it's one of the biggest things that kind of draws a pushback from people. So like having a one-to-one conversation, like somebody mentioned, that's very, and that's actually, it's very significant.
Yeah, so I would like to add on this and jump on. So on privacy and stigma, there is a certain stigma, like it was mentioned by Kenga earlier, where people do not openly share the struggles that they go through. And sometimes it's even counterproductive because, they would probably trust a public service that they would, subscribe to in order for them to receive assistance more easily than they would confine into their fellow immigrants, somebody coming from the Congo as well, because the stigma is that you really do not want to project your suffering onto everyone, onto the public. So it's important for our outreach worker or the program as it is developed to keep that in mind, that we want to make sure that the person can still retain a certain level of dignity. And if the program is tuned that way, it would be so much easier to be presented to people and reduce the barrier, because people want to protect that sense of dignity, even though they're struggling, because I believe that we do have a lot of families that are struggling in silence. I would also like to add one specific about the DRC. A lot of our population in the region are also people who came by way of refugee programs because of the struggles that were in the DRC. I mean, I was looking at a report from the Pew Center of last year. Out of the 18,000 refugees that were admitted in the United States, 13,000 came from the DRC, and 20% of them basically were accepted in Maryland, were resettled in Maryland. So I want to put an emphasis on them because they are some of the most vulnerable people in our community. They come through a program where they've been uprooted from one area to another and they have to resettle. And they usually have language barriers, which means that they cannot communicate easily. They cannot get the best jobs, and they usually rely on social services. So with the impact of the pandemic, the COVID-19 pandemic, I would think that some of those people would be very, very, very vulnerable at this very moment, and including immigration resettlement centers or refugee centers or organizations that take care of that would probably be a good way to reach out to that segment of the population.
Have you seen any other benefits from collaborating with Mana and SACU and all the other community leaders?
Yes, to us, it's a great experience. I mean, me personally, I'd never really got involved that closely with trying to address food insecurity within our community. So the first aspect is awareness, right? The fact that more of us are talking about that is a difference. We are also bringing different lights. I don't know what was the image of people who were representing groups that were pertaining to help people with their food insecurities. But right now, I think we have an opportunity to kind of create a diversity in the image and the approach, because at the end, we want to remove that stigma and we want to help people who are suffering in silence. because we have a lot of people, and I heard by anecdotal evidence that there are families that are truly struggling. And if I had to recommend the name of some of those people, they will probably not admit it on the phone, even if some people were there offering to help them. So that stigma is an important barrier that we need to address.
Absolutely. Thank you, Tony. You bring up stigma as an important issue that we'll talk a little bit more about. But Clement, I wanted to find out from you, have you seen any other benefits to the efforts that you've been doing right now? Or any?
Yes, I'm actually seeing those efforts. Like I said, I've had some, communication from people that were just recommended, with the program within our community. So that kind of outreach, I mean, I do get some messages through SACU and other groups, so there's a very good, communication, benefit to that, because, like I mentioned earlier on, it's becoming more exponential, so it's easier to, at least to kind of get message back and forth from different kind of, situations. And then thing I wanted to mention also is that, I may bring this maybe later on, but, I have a couple of students that I went to school with, most of them, they're international students, but they don't really, like live around the Montgomery area, and they're facing these kind of challenges, because of, work and stuff like that. So that's something I just thought to say, oh, I belong in this kind of program, and I can see how best I can come in, even though, there's kind of, regulations in how we support people outside that. So that's something I would maybe going in the future, we can kind of discuss, see how we can, help, those people who are actually not within ourselves.
That's great to hear. Thank you. And I think also the collaboration allows us to tackle stigma from different angles. I think if we're able to tackle it from different community organizations, it's just more of a group effort. So let's move on and talk a little bit more about addressing stigma with Dr. Ruvi Tsokodayi-English. Ruvi, are you still out there?
Yes, I'm here.
So, when it comes to accessing safety nets like food assistance, some African immigrants carry some negative associations, as our last two speakers just talked a little bit about. Now, you're a senior research analyst with the district in North Carolina. And, could you tell us a little bit more? You also have some experience working as a family therapist, and you have a professional interest in addressing family stress and coping for immigrant communities and refugee families. In your work in that capacity, what have you seen when it comes to people's willingness or perceptions about getting food assistance or any in general?
Yeah, so I will say, I'll start by saying that, we're talking about stigma and, trying to overcome it. I will say that the stigma is real, right? Whether we like it or not, there is a lot of stigma surrounding people who access social safety nets, especially for people of color here in the US. And then you add, the systemic racism and discrimination, lots of stereotypes about people who seek food assistance or just assistance in general, being lazy, they don't want to work, they are poor, this culture of like, you're poor because you choose to be poor. So we're fighting a lot of that. So that's the first thing I'll say, is that it is real. And then to add on top of that to our experience as Africans, I think the places that we're coming from already, we don't have an experience with a lot of social safety nets to begin with. We do rely on family members, communities, and I think it's good that people are highlighting that even now that we're living in the US, lots of religious leaders and community leaders are people that, those are people we're going to be able to sort of like, try to remove that stigma. Lots of psychological perspectives and philosophical perspectives talk about this idea of your self-worth, right? Like we are what we eat. A lot of the times from a psychological perspective, we are what we think and believe about ourselves. So if we believe that for some reason we've come to a place in our lives where we now need to seek help outside, that manifests, and that you know, people start thinking that about themselves, like, well, it must be something about me, you know. But that's something to consider, that just overcoming that, and I'll talk about some ways that we can start to overcome that. And I did want to mention, just in line of this piece of stigma and living in the United States, there was a study done in 2004 that showed that even though services are available, only between 40 and 70% of people are actually really accessing them. So there is help available. And there's many reasons why that's happening. There is help available, but why are people not actually going out and seeking services? Again, it comes down to that stigma. It really will prohibit or prevent a lot of people from going out and saying, oh, hey, you know, I need help. It really will discourage a lot of people, a lot of families. And just another point, another study I was going to highlight that talked about people who were participating in food stamps had a higher chance or higher likelihood of suffering from major depression. So you can say, okay, well, it could be because of other factors in their lives, that they're seeking food assistance, that they might be predisposed to depression, but there was actually a link between people who were seeking food assistance or seeking food stamps being at higher likelihood of suffering from depression. And, you know, I have seen in my practice sort of like people who, I had one lady who was explaining to me, you know, a situation that happened, and she would say like, well, I didn't want to go. She would go and do like self-checkout she had a food stamp card, and she would do self-checkout because she didn't want people to know that she was, you know, receiving food assistance. So it is real. I want to acknowledge that for everyone who, you know, has had to face seeking out help or will face seeking out help, that there are many, many barriers, many institutional level experiences with discrimination and that sort of thing. And again, I think someone else had highlighted this idea of, you know, as Africans, when you come to the US, you're really working hard to be successful and to overcome. And so there is that sense of like, if I say, you know, oh, I need help, you know, somehow I have failed. And I think it's even more highlighted for people of color, you know, Black and brown people.
Yeah, that's an interesting, that statistic you shared about 40 to 70%.
Yeah.
Available resources not being available.
Not being used.
That's pretty eye-opening.
Yeah. And so, yeah, the flip side to that is my main message, my main takeaway is, you know, if you qualify and if you are able to get assistance, use it. You know, so many people are not using it because they're being, you know, they're either self-talking themselves not to do it, which is, you know, like I've just kind of did a talk about the landscape. You know, it's real. People are being looked down on for it. However, if you qualify and it's there, you know, you should use it. That's what it's there for. You know, and I think as Africans, we already have this idea of this, you know, togetherness, working together, being there for each other. A lot of people talked about the religious community members who are there. Get people involved, you know, increase awareness, you know, more education surrounding and information surrounding accessing, you know, food assistance and other types of assistance. I think is a good starting point. Chances are that if if other people are feeling the same way and they're also not accessing resources that are there for them to use. And so I will definitely say, you know, we talked about there's no shame, like there's no shame. You know, the resources are there for us to use. And you know, this idea, I want to go back to this idea of the togetherness within our community. You know, you might be in this particular moment needing help, you know, needing to seek assistance. And another point in your life, you might be the one to give help, you know. So, you know, if you get help, it's great. You can also give help at some points as well, you know, even in that situation that you're in. So we're all making meaning of our experiences through interacting with each other and through our shared experiences, and hopefully just increasing awareness and being there for one another.
Absolutely. I mean, you talked a little bit about the institutional impact for minorities, especially as Black and brown people, that impacts people's abilities to want to use food assistance. You also talked about a little bit about personal associations that people have. Do you feel that there's a stigma on the community level that people are concerned about, which is a little bit of a juxtaposition with the idea of togetherness and Ubuntu?
Yeah, exactly. Yeah, and I think someone else had, maybe it was Tony or somebody else said, you know, it's like us being the sense of togetherness, it does help us, but it can also hinder. Some people might even feel more comfortable, you know, going to a building where they don't know anyone and saying, or, you know, doing an application and saying, okay, can I have some sort of assistance, rather than really talking to people that they know and telling them, you know, this is something that I'm going through and I need help. So yes, I think it's a blessing and a curse in our sense, the togetherness, because we have the resources amongst each other to help each other. So the Mana Food Project, we do have the resources, we do have the sort of manpower to help one another. And as immigrants, when we come from Africa to the US, we rely on each other so much as it is. And so we need to be using that. But there's always, and again, just talking to each other. I appreciate Kenga and her experiences talking about how she has to kind of work people, call them back again, you know, that sort of thing of seeking help within the community and being there for each other, and also providing information and providing knowledge and education. So a lot of you know, the confidentiality piece, people are not going to talk about your business, you know, and if they are, you know what, so what? You know, the people that you are interacting with, and if they are talking about your business, you're doing the right thing by managing your situation. You know, you're taking control of your own situation. Whatever's going on with those people, you know, that's not your problem. And I think sometimes a lot of, as an African community, we do care about the way people view us and the way people see us, but we also have to provide for our families and do what we need to do. And if the resources are there, please, you know, take advantage and use them.
And I think it's important, you know, to remember that we all can find ourselves in a situation of assistance at some point. And just keep in mind that, you know, sometimes people do need help, and it's not a personal judgment or failure.
Yeah.
And I think that some families from the African community who come here might be coming from an upper class. So not everybody's coming as even if they're a refugee, they might have been in a different class in their home country. So can you talk a little bit about the impact of class on?
Yes. Yeah. And sorry, you can finish your question.
Oh, that's it.
Okay. Yeah, you know, the main thing to highlight, I think I was talking about this idea of this social meaning that's attached to acknowledging that you have need, right? I think all of us, I don't care how wealthy, how well off you were when you came from Africa, we all experienced some sort of social, I don't even want to use the word decline, but we experience some type of social change in our situation when we come here. That's the nature of the landscape in America. You know, you might have been working as you know, in a really high position, a company in your home country, and you come here, and to make it work, you're gonna take a job that you may not have been, you know, working in Africa. And I think that's part of our strength, though. You see, that's part of why Africans are so prolific when we come to the US, is because we're known for hardworking and we'll do what it takes to get by. And so there is that social class piece, but I think a lot of, if you do find yourself in a position where you're able to take assistance, don't suffer in silence. I mean, I just think that the awareness and the education and the sense of you're doing this to better yourself, you're doing this to alleviate your suffering, I think should overcome the shame. And again, it might not, because we live in a society where there is so much discrimination towards people of color and towards people who experience poverty. But you know, that's my takeaway. We have what it takes to to survive. We're survivors in a sense, but we do need, we need help along the way.
Absolutely.
To use the help. Yeah.
Yeah, I think we all do, and we never know when we need help. And it also reminds me that a lot of people come here for the American dream. They may not want people back home or whoever to sort of to think that they haven't made the American dream.
Yeah.
Dream.
Well,
So
and the people back home also, we can talk about how it translates to our home countries, but the people back home too would be struggling and might benefit from some of the assistance. And so it's just a matter of understanding, making obviously we all make shared meaning, but making meaning of your experiences and doing what's best for yourself in that situation and not worrying about what other people are going to say or think.
Absolutely.
Yeah.
Thank you so much for that.
Yeah.
Important things to keep in mind. I think other issues that people might be concerned about as they come to the US and they're seeking that American dream is making sure that they're able to attain it, to get citizenship or to get that green card. So let's move on to our next section and talk a little bit about navigating the law during the pandemic and when you are in need of assistance, such as food assistance. Next, we're going to speak to our legal expert, Mercy Changwesha, and she's going to talk about how the legal system for immigrants and accessing social safety nets are impacted, especially at a time like now. Welcome, Mercy. Thank you for joining us today. So Mercy is an attorney at law who is licensed to practice in North Carolina and Minnesota. She received her JC from the University of Virginia. Mercy, I've heard recently about the public charge rule. What is the public charge rule and who does it apply to?
Hey, Togo, thank you for this opportunity. So I'll talk a little bit about what the public charge rule is. So the public charge rule, it's not new. It's been in the US immigration system since the late 1800s. So the basics of the public charge rule, it's this concept of self-sufficiency that the US says for immigrants to be admitted to the United States, they have to show that they will be self-sufficient. They will not depend on government assistance for their day-to-day living. So what happened in the past year is that the public charge rule basically got updated to include several public benefits that were not included before. So those public benefits include food stamps, and it includes certain types of medical assistance. In the past, really public benefits that they looked at were cash assistance. So if you received cash assistance from a government program, then you would be deemed a public charge. Or if you receive long-term care at government expense, if you receive long-term medical care at the government's expense, then you would be considered a public charge. But they've changed this rule to include several other types of benefits, including food stamps, which is relevant to the discussion today. Now, the problem is there's a lot of confusion about who the public charge rule applies to. So if you already have a green card, the public charge rule does not apply to you. So people fear that if they have a green card and they apply for public benefits, then when they try to apply for citizenship, they'll get denied. But the public charge rule does not apply to people who already have a green card. The public charge rule also does not apply to these are what we call mixed households, where the parent may not be a legal permanent resident, but they have children who are US citizens. So if you apply for food stamps for your children, the public charge rule will not attach to you because that application was not for you. So the food stamps really are for the children who are eligible because they are US citizens. So I've seen a lot of parents who have children who are US citizens be fearful to apply for food stamps because they think it's going to affect them when later on they apply for a green card. And that's been a big misinformation because that's something that they're eligible for and that they should take advantage of. So that rule will not apply to you when you apply for benefits for your children. It also does not apply when the children receive a school lunch, or if they receive a free school lunch, or if children receive CHIP, which is the medical aid for children. So the public charge, so it's fine to get medical aid for your children. It will not affect the parents. Also, the public charge rule does not apply to emergency medical care. So if somebody needs emergency Medicaid, that will not affect them. when they apply for their green card. Also, the public charge rule does not apply to every type of immigrant. It only applies to people who are applying for a green card under certain categories, but people who are applying for a green card based on a humanitarian basis, the public charge rule does not affect them. So people who came as refugees, people who are adjusting their status based on being an asylum seeker, people who have been victims of abuse, who fall under the VAWA, or people who have been victims of human trafficking under the T visa, or people who have been victims of crime under the U visa. All those categories of people are not affected by the public charge rule. And unfortunately, people are having a hard time understanding that. You see people who've been victims of abuse, women who've been victims of abuse, and they are pursuing their VAWA-based green card, and yet they are living in fear, and they have no basics. They don't have food, and they're afraid to apply for benefits. So that's something that it's really important for people to understand, that it does not apply to everyone. And also the types of benefits that it applies to. It applies to benefits provided by the government. It does not apply to benefits from a food pantry, for example. It does not apply to benefits from private organizations. So people have been afraid even to go and get food from food pantries, or to get food from maybe the church, because they think somehow it's going to go on their record and it's going to be a problem when they apply for their green card. So while the public charge rule is something that's important to keep in mind for your future immigration status, it's also important to realize that there are so many resources that you can take advantage of without actually jeopardizing your immigration status in the future. So it's something that it's very important for people, if there's a benefit they want to apply for, to really take the time to figure out whether it's okay to apply for that benefit or not, and not just assume that it's going to be a problem down the road, but to actually take advantage of the resources they need. Because right now, especially with the pandemic, it's very sad to see people not taking advantage of resources that they desperately need, because they're afraid that it will jeopardize their immigration status in the future. So it's important to really take a look and see whether what kind of resources you can take advantage of, and take advantage of them.
So Mercy, I think I heard you say that it doesn't apply to food banks and other nonprofit assistance programs, and that it only applies to federal assistance. Does it also apply to state assistance?
Right. It also does apply to state assistance. Any assistance that is from the government. Of course, not all assistance from the government, but it only applies to government assistance. So whether that's federal or state, it applies to those. But it definitely does not apply to food banks. It doesn't apply to, some churches have programs to give people food. It does not apply to that. And I don't know if there's a way for food stamps to really, for food banks to really make sure that people understand that it's okay to come and pick up the food. And maybe when they register them and not really take down a full name, maybe that would make people more comfortable to know that it's not going into some sort of database that's going to give them a problem down the road with their immigration status. So yeah, it definitely does not apply to food banks.
That's great to know. And you mentioned a couple of other really important things to take note of about when it does not apply, which I think we should all take note of. For example, if you're applying for US citizens' children, and it's not for you, that's not going to impact it. You talked about emergency medical aid, immigrants who are refugees, and anything else that I left out?
Yeah, so a large category of the immigrants that are adjusting their status based on humanitarian visas, so including refugees, asylum seekers, people who've been victims of domestic abuse, people who've been victims of human trafficking, people who've been victims of crime who are applying through the U visa. So all those people, because they already have several problems already. They're already dealing with so many challenges that the government has seen it fit not to also burden them with the public charge rule. And another thing that I think is important for people to realize is that the public charge rule right now is still pretty new, and it's very much in flux. and we have a new administration coming in. So there's a huge hope that this public charge rule is going to be rolled back to go back to its original state. And at this time, it's so difficult for everyone that it's really important for people to prioritize, because while your immigration status is very important, it's also very important for you to eat. It's very important for you to make sure that you take care of your healthcare needs. So you also have to keep that in mind, and really know that the public charge rule, the way it is right now, it doesn't mean that it's always going to be this way. And hopefully by the, before this administration is over, it will be rolled back to its original state, because a lot of people are really struggling with this rule. Number one, understanding what it is and who it applies to, and also just knowing that it may not apply to your particular circumstance, but just knowing that the rule is there really causes a lot of confusion and a lot of fear. So hopefully it will be rolled back.
So you mentioned that even though public charge has been around since the 1800s, its new application or definition is something that's new. When did this new definition start, and what kind of impact has it had on people who want to seek assistance?
So it was supposed to go in effect last year, October 15 of 2019, but because it faced a lot of legal challenges, it was actually stayed and ended up coming into effect February 24 of this year of 2020. In terms of the effect, and that's the funny thing, a lot of immigrants actually don't qualify for a lot of the benefits that would make you a public charge. So a lot of immigrants actually really don't qualify anyway for Medicaid, don't qualify for food stamps. So most immigrants who end up getting food stamps are actually getting them for their children who are US citizens. So in terms of actual practical impact, we really haven't seen yet a giant negative impact. The most negative impact has just been fear, instilling fear in people. So people have been afraid. People who were already receiving food stamps for their children, a lot of them became afraid to even apply for their green cards, because they thought, I'm going to get denied, I'm going to get deported. So in terms of the impact, it's really been more of a chilling effect for immigrants, and really just stopping them from either applying for the help they need or applying for the immigration benefits that they qualify for. And then also, like I said, the rule is still new. It went into effect in February, and then USCIS has not been working at full capacity for several of the months from February until now. So we haven't really had a chance to see the full impact. And we also haven't had a chance to see, because the new public charge rule puts in a bond. That means if the government has decided you will likely become a public charge, then you will have to pay a bond. And that bond, the minimum is 8,100. So right now we haven't seen those cases where they've decided this person needs a bond. So it's still in flux. We're still watching the applications that we sent in after February 24 to see how everything turns out. But hopefully it won't have a huge negative effect in terms of actually receiving immigration benefits.
Yeah, let's hope it doesn't, and that maybe it's going back to its older definition, because that's a lot of money
Yes.
for a bond. You also talked about, for those who are eligible for, I guess, federal or state assistance, I think part of your definition said long-term care. So what does it mean to have long-term care? Does it mean that if you needed food assistance 1 month, you're under public charge, or is there like a time period, like let's say, if you needed it for a year, then you're considered a public charge? Are there parameters like that?
Right. So the way they've defined public charge is if you have received 12 months of public assistance within the last 36 months. So not within the last 36, within any 36-month period, you received public benefits for 12 months. But then the way they calculate the months is for every public benefit you get for 1 month, it counts as 1 month. So if you receive 2 public benefits in 1 month, it counts as 2 months. If you receive 4 public benefits in 1 month, then each month counts as 4 months. So if you receive 4 public benefits, you would get to your 12 months in 3 months.
Wow.
Because each public benefit is counted as 1 month for each public benefit you receive, that's for 1 month, that's 1 month. So it's not really a consecutive period. It just depends on how many months you received the public benefits for. Yeah, so depending on how many public benefits you get, you could actually become a public charge in 4 months or in 3 months. Yeah.
Wow, that is very, very complicated definition and way of looking at things. But thank you so much for that really important information. And for anybody who wants to get more information about Mercy, you could go to the SACU website and get more information about her practice. And it definitely, it's so complicated. You know, it would encourage me to make sure that I seek the assistance or the advice of somebody who's aware of what all these legal definitions are. They definitely did not make it easy.
Oh, yeah.
Yeah. So thank you so much for that information. So we're going to move forward. We're at the hour, and we wanted to make sure that we provided an opportunity for other members of the community or community leaders to also talk about what they're experiencing and to give us a point of view from their community. But before we open it up to a general Q&A, you know, I'd like to make sure that anybody else who's here, who's a leader within a different community, would please just chime in, tell us who you are, what you're doing, and just your thoughts about food insecurity and how your organization can help or participate. I know that we have somebody here from the Angolan Community Association, Alberto Macazamba. Could we start off with you? Could you introduce yourself and just tell us a little bit more about whether your organization has been involved and what you have been doing?
Okay, number one, can you hear me?
Yes, we can hear you.
Okay, thank you for the opportunity for this interesting topic. My name is Alberto Macazamba. I'm the president of Angolan community here in Washington metropolitan area called Kudisanga. Before Kudisanga came around, I have been helping fellow Angolans for a long time. Based on my experience, stigma, as was mentioned, is a serious issue among our people, African in general. Also, what I experienced when an African has issue, prefer to share it with another African who's not from the same country, more than from an African from the same country. So those are the issues I come to find out. Why? Because they don't want people to broadcast their issues. That's the reason why. Now with food assistance, also what stands in a way for people to accept the assistance is our pride. That pride I experience even in my own family. I have two boys. One boy in his school, they give free food, and he never accepted to go get it. He said, "Daddy, we're not in that level yet. Why do I have to go get food?" So he doesn't like it. But one time I just tried to go get the food for him to see what kind of food they were giving. But he doesn't like it. Now to make, also I have another boy who's in college. He's a very proud boy. Even if he's in need, it's hard for him to call home to say, "Hey, Daddy, I'm out of cash, I need this." No, we have to go after him. So that tells me the human pride we have. Even myself growing up, I never considered myself being poor. I consider poor those who are crippled, who cannot help themselves. So that's the mentality I grew up with. Even now, I'm not a millionaire, I don't have anything, but I do not see myself as being poor. Now, in the community, before pandemic came, I helped fellow Angolan who lost house, was really in bad shape. I even tried to find a lawyer to help him, but it didn't go the way we expected. Then I had to assist him I could use the word on the table, so no one could know. As my sister Kenga mentioned, I don't know if she's the one who mentioned that the contact she had with one person that she said, what we talking about is just between you and me, no one else will know. So that's the same line I helped that fellow Angolan. I said, is a top secret between you and I. I would never ever open my mouth to share it with anyone else. So that's what made him comfortable and open up to me. Sometimes even didn't have food. He called me, hey, Brother Alberto, I'm in need, I'm coming to you. I said, yes, come. So we met, I need this, I don't have anything to eat. I said, okay, let's go. I don't have money, but let's go to the store, get whatever you need, I'll charge you my card. So that's how I was helping him. Then with this food assistance, also there's skepticism people have. They question what's behind this program, because sometimes things that have a good appearance, not everything that glitters is a gold. So we don't know what is behind the program, what's the payback. Those are things people sometimes question. He said sometimes people have to use honey to catch more flies. If you use vinegar, you're not going to catch any. So these assistants, people in this time, so much going on tormenting people's minds. You have conspiracy theories, you have so much going on. So people are not comfortable to give in any program.
Right, and that's true. I think a lot of our speakers spoke about the stigma and like the different people that, the different reasons that people are resistant to getting care. But thank you so much for sharing about how you have seen that play out within your family and within the Angolan community. I want to make sure that we give the other community members that are here a chance to speak. But what you were saying also just reminds me of what Dr. Ruvi had mentioned, in that she had said that a part of our strength is also our weaknesses, which seems to be very true. So let's welcome
thank you.
Vanessa Mdolo, who's from the Malawi-Washington Association. Vanessa, could you talk a little bit about how you've been involved and what you have experienced?
Hi, everyone. I'm representing MAWA today. And so our goal really has just been trying to put a familiar face to what MANA is currently doing, and also just making sure that people within the Malawian community are aware that there are a lot of programs and organizations right now that are available to provide food services to those people that need, that might be in need of that service. And we also just want to make sure that at some point that maybe to create kind of like as a community, to just create some sort of resource even for other people who might not be in Montgomery County, for all the community, even outside of the Malawian community, to get access to know where they can go if they need assistance, not only around food, as someone mentioned before, around energy assistance or any other services that are out there that people might need.
So Vanessa, have you noticed the same issues within the Malawian community with stigma and the barriers to getting access? Is there anything specific that might have jumped out for that community, that might be specific to that community?
Yes, as we mentioned, yes, stigma, but as well as also that when we posted that MANA was the program that currently MANA is doing, we did get a lot of feedback around people wanting to know if there are other services in other areas, because not everyone, again, as I mentioned, lives in Montgomery County. Other people live in other counties also that need services. So that's why we want to work on maybe in the future, even within this group, maybe if we can just share more resources of things that are available in other communities outside of Montgomery County.
Yes, and the SACU website has a list of resources that are available in other counties and in other areas. So that's definitely something to point people to as well. Yeah. Thank you, Vanessa. With us, we also have Portia, and Portia is part of the Zimbabwean Association. Portia, thanks for joining us today.
It's my pleasure. Thanks so much. Let me put on my video so that you can see me too. Okay.
Great to see you, Portia.
Great to see you too. Yes, we have been talking about mana in our community meetings, and we're hoping that people are taking heed and they're trying also not to fall victim of feeling that they are, if you go to mana and get some food stuff, you are being looked down upon. So I've had the experience of going to mana myself so that I could see what happens there. And from what I've seen, they are very organized. You get there, they ask you for your ID, you show the ID, and then they check in the book because everything is pre-planned and put in the system, and they just check your name, and then they'll say either wait here or follow me. Then they show you the trolleys that you have with your food in. You take it to your car, you bring back the trolley. That was one incident that I also experienced. Then the other incident was when the ID was different from the address, but there was another statement that showed the address where the person is living. They just look at the ID, make sure that's your name, and ask you if you've got another, like anything that shows your current address that matches with what they have in the system, and you show it to them, they confirm that, they check your name, they say to you, wait here, they go in, bring your trolley, and boom, you are gone. It takes less than 3 minutes. Mm-hmm. So they're very organized and they're very polite. And when I went there, I've seen people of different races, people of different colors coming to pick up the food. So it's for everyone. And they are very welcoming, very affectionate, and very willing to help. And if you've got questions, they will let you ask the questions, they will explain to you. So I think our major challenge is to convince our communities that this period that we are living in is temporary, is gonna pass. Right. And a lot of things happen when you are in a period that is not normal to what you are used to. Once we realize that, we should be able to feel comfortable and reach out for help. Because if we don't reach out for help, then no one is going to know that we are drowning and we won't get the help that you need. And
you mentioned about the foods that you experienced at a pickup. What type of foods were available? What type of people expect?
The foods that are available are fruits, vegetables, tinned fruits, milk, rice, spaghetti, tomatoes. It's quite an array. Right. And they also give you like ground beef and ground chicken. And when I went there, I'd gone to help out 2 other people as a community that wanted to see how it goes so that I can be able to explain. And if I come across somebody who's got the same predicament, I can be able to walk them through and let them know how it goes.
Right.
Yeah. So yeah, they do give quite a bit.
Yeah, that's a great idea if you have the opportunity just to walk through and experience. And I know that with COVID, it's now contactless, but it sounds like you still had the opportunity to see what was available.
Yes, as long as you have got your mask, you don't touch anyone, you don't greet anyone using their hands, you keep your distance, and that's it.
Right, right. And I know most of us Africans like our stews with tomatoes and onions, and some people have different dietary concerns. Is that something that's considered as well?
Normally, when you are being registered, if you have any dietary concerns, you mention them there. Mm-hmm. So by the time you go to pick up your stuff, not knowing how they pack them, because whatever there is in the box is what you take. So maybe when you get home and you see that there's chicken in there and you don't eat chicken, maybe only then you can dispose of it. But for the most part, they put in foodstuffs that general people eat.
Right. So I think our outreach workers play a key role in making sure that when they receive the calls, they're able to take people's information and ask about, what special needs they might have. And I know that is making an effort to also include foods that you might eat from your background, like sweet potatoes or cassava and things like that. So that's something that might be available to people at different times as well. Well, thank you so much for sharing that, Portia.
It's my pleasure.
Thank you. We also have Lloyd, who's with the Mozambican Association. Lloyd, could you have you speak a little bit about how your association has been involved and what experiences you've had?
Yes, absolutely. My name is Lloyd Pondeka, and thank you so much for this town hall meeting. I'm the former president of the Mozambican Community Association, and with regard to some of the issues that we've ran into, we've pretty much covered it throughout this meeting. Namely, one being pride, people being concerned with regard to their privacy, and kind of like the information that has been shared throughout this meeting has been very helpful. And I hope our people will actually take heed to it and, kind of listen in to, this broadcast, because I think that'll cover all of the concerns that they've had. In the past, we've had different initiatives because Mozambique, unfortunately, had been hit by a number of disasters, 2 cyclones, which happened last year. And our people tend to think of the only ones that need help are back in the motherland within the country itself. So they kind of disregard any of the situations that they might be undergoing themselves. So with that said, it was mentioned earlier in this conversation that everybody looks at their own kind of social position as they're not poor themselves, or whatever the case may be, that they don't need help. And there is the issue of pride with regard to that. So I think this program that we have with MANA, it's a really good one, and we're very happy to kind of be a part of that. So I think with all of this information, what we're going to do is we're going to keep telling everybody that, if you do need help, don't have that stigma behind it, and your privacy is going to be upheld, with regard to immigration, which was covered before and everything. So at that point, I think that we'll have more Mozambicans, and it's not only Mozambicans, which was mentioned in here, it's just anybody who might benefit. I think it'll be a very good thing. And so on my end, I'll continue pushing the agenda forward. And also too, like if MANA, like there's with something, with the benefit that MANA provides, people kind of get suspicious with that too, because they tend to question everything that comes their way. Somebody said earlier in the chat that everything that glitters isn't gold. And that's a very true statement with regard to what people's, mindset is with regard to accepting help. So on my end, I'm going to I'm going to continue trying to educate and trying to have Mozambicans feel more comfortable with this program. So I look forward to that. And I'll definitely follow up with everybody who's a leader within the organization and of the self.
Great, thank you so much, Lloyd. And definitely education is a key part of it, and raising awareness, getting people to understand what is out there and how it can help them, and what to focus on in terms of how you can help your family. So if there is anybody on the phone who would like to ask a question, please go ahead and just jump in now. If you're online, you can raise your hand by clicking the raise your hand function, which I have to find on here, or you can also type your question in chat and we'll be more than glad to answer it.
Omega has a hand raised.
Application.
Sorry, Omega, what was that?
No.
So I just wanted to, my statement is not a question, but I wanted to address a question that you had asked about the dietary needs, or if they are considered when you get your food. So yes, that manner does take into consideration a person's dietary needs. For example, if you're diabetic and you do mention that you're diabetic, you're gonna get diabetic friendly foods that's in your package. So people are encouraged to outline their dietary needs.
Great, thank you for pointing that out, Omega. Any other questions from the those that we have joining us today? If we don't have anything yet, I wanted to ask each one of you, what steps do you think we can each take to address everything that we heard and help overcome stigma and help overcome the lack of people accessing resources?
I believe more reach out. We excuse me, had to be one-on-one reach out and explaining about the program to make them feel comfortable.
Mm-hmm. And maybe just having discussions with people in general outside of when somebody has a need, but I think just discussions like this town hall, or just when you have your one-on-ones that you talked about, maybe just talking a little bit more about the issue of food insecurity and hunger. That's definitely a great tip. Thank you.
Toko, I was going to answer your question by saying, to piggyback off and saying platforms like these, definitely, so people don't have to, necessarily be talked to individually, but more just a broad conversation. People, say what they feel, and we kind of address the stigma, I think is really good. Another point I was going to make, I think it was Albert was talking about, his sons and how the pride issue. And one thing I wanted to highlight is, one way that people in power, keep oppression going, systems of oppression going, is making, poor people feel like they're somehow defective because they're seeking assistance, right? But a lot of the time, especially in the US system, even a tax break is government assistance. Large companies, when COVID started and the bailout happened, a lot of big companies were bailed out by the government. And then a lot of the money was even returned back to the government because it wasn't used, right? So we're talking about this. People are not aware that there are programs in place. And so, and I remember back in March or April, the thing going around was like, oh, you should have 3 to 4 months amount of savings to cover your bills for the next 3 to 4 months, right? And so, but when all these companies were going bankrupt in May, nobody was saying anything, and they don't have shame to ask the government to say, like, these large airlines, all these large companies. And so I think looking at it from a perspective of how do the people in power keep people from accessing assistance, money that's there, money that's available, programs that are available, is by sort of the, trying to highlight the mentality of like, or keeping the stigma going. And so I think us talking about it within ourselves with these platforms and other ways, I think is a really good way to, make sure that the stigma kind of, goes away. You can still feel stigma, but please act on what you have to do to look after your family or look after yourself. So that's
those are really great points. Yeah.
Yeah,
I think it is important for us to remember that this is a part of our public assistance that we're paying into for emergency situations like this, in the way that many companies and corporations do the exact same thing. Tony, you were?
Yes, just to piggyback in on what Ruvi just said. In fact, the way to address the stigma, if let's say SACU and MANA have an intention to have a campaign, that campaign can be tuned or at least developed in such a way that they squarely address that, information such that, Jared Kushner got assistance, right? Should not necessarily, should be an incentive for you to consider that you might also need assistance.
Yeah.
So there is a way in the way we address the campaign that could help everybody, but just looking at things that can be addressed in commonly, because each community has pretty much the same problem.
Mm-hmm. Absolutely.
Can I come in?
And I think there's been so much really good information that we, a lot of people aren't where from the legal perspective that we got and from the experiences of our outreach workers and community members as well. I know, Clement, you were about to add something to that.
That's okay.
No, please go ahead.
Okay, yeah, I was also just going to point out that I think one of the key things that we also should emphasize most is just being eloquent in how we kind of relay the message. You know, I know Messi did a good job in trying to, explain, the public charge and how it applies, because I'm under the impression that, not all people may have that kind of stigma, but maybe from a legal standpoint, they may be so hesitant because they don't want to, jeopardize, future kind of, prospects, of living in this country. I think also have to make it, just emphasize and try to explain more, the importance and, the pro and cons of, this program and how that may not apply to people who are in need at this particular time.
Absolutely. We're coming up to the half hour and towards the end of our town hall. I wish we had more time where I could do another one a couple of weeks or months later just to see how things are going and get additional feedback on people's access to food assistance. With that in mind, I wanted to ask if anyone else has any closing thoughts or comments that they wanted to share, especially our panelists who had the opportunity to speak. If there's anything more that you didn't have a chance to say that you'd want to add in.
Just really quick, I know that this is being broadcast live on Facebook, but I think on a practical level, this information with regard to addressing the stigma and the pride and so forth, I think with each of our respective platforms for our respective communities, if a link could be provided to replay of the town hall on Facebook, I think that would be a really good, help for people that that weren't able to tune in today. So that would also avoid having to repeat any solutions that we came up with in this town hall. I think that'd be very helpful.
That's a very great point. I think we do plan on making sure that the recording is available on Facebook and hopefully on the SACU page as well. Also, if you go to the SACU Facebook page, we have a really good promotional video that we just started sharing, and that's a good one for you to forward to other people as well. If you want to go there and just take a look at that. Actually, it should be available. The recording should be available right after this presentation. A good thing to forward to people as well.
Share it with my community, and I encourage other communities to share it with theirs on their respective platforms just as well.
Fantastic. And hopefully everybody will be doing the same. Well, thank you everybody, especially today's speaker, for sharing your knowledge, and all participants for being a part of this. Just remember to spread the word and keep in mind and keep an eye out for your neighbors and friends, and you never know who's in need. And so just starting this conversation and continuing this conversation is really what's going to have an impact. Again, please visit the SACU website and the SACU Facebook page if you want to know a little bit more about what you're doing, as well as if you want to go to the SACU, to the MANA website to see what they're doing. It's all available on the SACU website. Thank you, everybody, and I hope you have a good Sunday and a good evening. Have a great day.
Okay, bye-bye.
Thank you. And congratulations for how you run the show.
Thank you. All right, bye-bye.
Thank you, everybody.
Thank you.